Jim Clapper has been the first, I think the lead organizer, is that safe to say?
Co-leader.
The co-leader of the Minnesota Family and Advocates Coalition. They're a volunteer group. I think they're formed a 501c3 now.
Yes,
and independent, very powerful voice. As providers, we don't have the same influence when we're trying to make changes as family members and certainly individuals themselves. So to have a group that can be a collective voice for the state of Minnesota is powerful and helpful for all of you, even if it's a position that may not favor a provider. That's okay. As long as the positions are taken are favoring the individuals, the Minnesotans with disabilities, it's a great thing. But hopefully we're in line. We're all trying to do the same thing. That's why we get into this line of work. So with that, I'll introduce Jim Clapper, and thank you for coming down here.
Yeah, thank you, Steve. My name is Jim Clapper. I'm a parent. I'm a co-leader of MNFAC, Minnesota Families and Advocates Coalition. And I've also been on the board of another nonprofit, Midwest Special Services, providing services for individuals with intellectual and developmental disabilities. So I've had a little bit of background with that. I've got two other of our steering team members with me. Is Jerry Smith, who will speak a little bit later on about his case study, and then Nancy Wagner. All of us being parents of children with disabilities. We've got the agenda. Hopefully a handout there is an agenda. It looks pretty busy. We'll go through it pretty quickly. But we thought we'd give you some tools and some help in terms of understanding what's going on. There's a lot of things that are threats, and Steve covered them quite well, but we have pretty well focused on disability waiver rate setting. We've also looked at and trying to support, because it's so related, the workforce crisis, but basically we really started to keep ourselves focused on DWRS. We thought that was the most imminent threat. It still is a threat, but I'm happy to say that there's been a lot of work, and the three of us are part of that, I think, in terms of helping to have the legislature get some changes made with DWRS in the last session that I think will really moderate the damage that was about ready to be inflicted on ProAct and Midwest Special Services and many others that they're providing services for adults with disabilities. So we'll talk about that. So we'll kind of talk about what's going on with DWRS. The main event, though, is number 5, this legislative session, because our work is not done. We were successful in getting a few things changed. We were hopefully part of that. Moore was a big part of that, and their lobbyists and so forth. Many others were, some politicians like Jim Abler and Paul Utke from Park Rapids, and John Hoffman, and a couple others. Jeff Hayden was another one that really felt strongly that DWRS was broken. It was not done correctly, and they wanted to fix it. But the job is not done yet. We really think that there's going to be another couple of rounds at going after DWRS in 2018, which is a non-budget year, but especially 2019. So the job's not done, but for certain, we've got to really step up and be in the game and be ready for making even further changes with this, with DWRS, and hopefully the next couple of legislative sessions before it goes finally into full effect in the end of 2019. So with that, I'm going to go ahead and introduce Nancy Wagner. Nancy will take us through number 2. And we'd like to have this as a discussion. We've got questions along the way, fine. We may have to keep things on pace, and that's fine too. But we really want to make sure that you understand what's here and give you some resources, some tools, and some perspectives we've had as we've been formed for a little bit over a year, working on this pretty hard, testifying like crazy since January 23rd of this year. And with that, I'll let Nancy introduce who we are and go from there.
Good evening, everyone. Again, thank you for coming. We are MNFAC, Minnesota Family Advocates Coalition, and what I'm going to do is pass around a piece of paper and ask you to give us your name and email address if you would like communication from us in the future. So I'll just set this here now, and if you want to pass that around, and then I will talk a little bit about what we are. So that's page 1 of your handouts, and as Jim mentioned, we started in 2016 with just a handful of parents. And speaking of parents, I am a parent of a 32-year-old son who goes to Opportunity Partners during the day, and he lives in a Hammer apartment for evenings. So that's a little bit about me and my family. What we really try to do is educate and advocate as parents. And as Steve mentioned, we really have a stronger voice even than the providers. So we really try to get parents involved. Legislators tell us the same thing. It's the parents that make the difference. And that's who legislators and our governor listens to, our parents. We have boots on the ground. We know what's going on. We know what our kids need. So we are experts at that. And they really do listen to us. As Jim mentioned, our focus this past year has been twofold. One on DWRS. Speaking of DWRS, does anybody know what their numbers are? Has anybody checked to see what their rates are going to be for their kids in this coming year? Okay, we're going to talk some more about that then. That's good to know. DWRS is a rate management system that determines how much money our kids get for day programs and for residential programs. And what we found, particularly in the Twin Cities area, is those numbers are dropping by as much as 40%. My son is losing 43% of his funding for his day program. So that scares me. And that's what really fired me up to find out more about DWRS and what I can do as a parent and what I can do to support my day program in making sure that the services for my son are still there and that we have options. Yes, ma'am.
How are they determining those numbers? It used to be off the screening document. How are they making those determinations now?
Right now, it is it's an algorithm that goes into a, so it's an algorithm. Our kids' needs are rated. Those numbers are put into an algorithm, and then that number is spit out. So it's a lot less hands-on and more to do with numbers. Kind of takes the person out of it, if you ask me.
Yeah, we're going to talk about that
Okay.
under number 3, actually, in a little
Okay.
more detail as far as how that all came about and how it's affecting everybody.
The second focus that we had was, of course, on the workforce crisis. And I would bet everybody is familiar with that and knows that our PCAs and our direct support professionals, there's many jobs open for those positions. And the ones that are still working, they change jobs a lot. And it's been very difficult to have consistent staff. At least in my case, for my son, change is difficult. He has Down syndrome, and as new staff come and go, we find behavior issues and things like that when changes are made. So that was the second key issue that we really wanted to focus on as parents, to make legislators aware of this issue and see what we could do to combat that. And again, we'll talk in more detail about that and what happened in the legislative session this year. Unfortunately, there is no funding for that.
Mix up her life so she doesn't get
So again, we just want to have a statewide voice, and we thought by getting the parents statewide to all say the same thing to our legislators, that they're hearing the same message, and we have a much stronger voice when we're together than we are as individuals. So by advocating, bringing awareness to parents and to legislators, and some advisement. As Jim mentioned, we've spent a lot of time in the legislature and at the Capitol this past year, and we want to share with you what we've learned. On the next page, it goes into a little bit more about knowing your numbers, and I asked folks that already. There is a screenshot, and we'll again get in more detail, but what you're going to want to do is talk to your service provider. Your service provider should have that information for you, so that's the person that you want to contact and ask for a screenshot. And Jerry's going to actually show you an example of what that screenshot looks like and how to read that screenshot. The second thing that we're doing that we're really excited about this year, we've been working with the Department of Human Services to develop a advisory council for the Health and Human Services Division to work with them before they put all of this legislation and all these rules into place. We need to get ahead of this. Rather than react as parents, we want to be part of the solution. And so we're really excited that they see the value in that, and they're going to be starting up an advisory council for parents and people with disabilities to work with them to help develop these programs that we need for our loved ones. And that is just in the works. We're going to be starting that up pretty soon. Then on the bottom of the page, we have a little bit of a glossary because Jim is famous for talking in acronyms, and he laughs because we pick on him all the time. So you might want to keep that handy, but we're training him, so that's good. The next page is a handout that has all kinds of links and all kinds of information that you can get more detail. That's why we printed all this material for you to take home with you and read through it at your leisure. This is not a homework assignment, but we do want to make sure that if you want more detailed information, you have a place to go to get it. Jim is going to be talking, and Jerry, about the impact study, which is the first link on the page. We're also going to be talking more about probably more, and that is the like the day program provider. It's the umbrella that all the day programs, or majority of the day programs, I think there's like, what, 120 day programs that now subscribe to more. So again, that's one place to go, and they're trying to get one voice for the providers to use too, and that's through more. The other organization for the residential is called ARM, and they too are an organization that tries to help bring one voice to the residential providers and get that message across. I think with that, I will turn it over to Jim so that we can talk in more detail and get more specifics. But I wanted to give you a little bit of an overview of what we will be covering tonight and what our key focuses are as a parent group. And I sincerely hope that you will provide us with your email address so that we can get that information out to you. We promise not to bomb your emails. I think we've sent out 2 letters so far, so we don't send out a lot of information, but what we do send out we feel is really, really important. We also have a website. It's called MNFAC.org, so MNFAC.org, and you can find that all these handouts are out on that website and other pertinent information. We also have a Facebook page, and we post a lot to the Facebook page. So I hope that you will check that out frequently. We do update it with just more information of what's happening in this community. The other thing that I want to mention really quick is we're having our statewide meeting on July 18th, and that's going to be at the Brookdale Library in Brooklyn Park. You will find that information out on our website and on our Facebook page as well. And we will also be emailing people, again, with that information. So I hope you'll consider attending. We're looking at having a legislator attend or one of our lobbyists. So we're really excited and are going to have some good speakers for you and can provide more information for you.
Okay, good question on DWRS. This is the one-pager. Basically, is a summary of this report. This comes out, it's probably about 63 pages long. It comes out once every 6 months from Disability Services Division at DHS. By the statute, they're required to provide an impact study. It is very well done. It talks about each county. It talks about each type of, there's 4 different types of disabilities talked about in here. It's really a great report, but this if you don't want to read this, this is really reflects that pretty well, I think, in one page. So let's kind of just walk through this, because I think it's good to get a background about what is DWRS, especially keeping in mind that, like I said before, the job is not done. There's still a lot of things we'd like to try to get with the rate system. So starting with number one, 2007 is when CMS, Center of Medicaid and Medicare Services in Washington, these are the people that control the waiver money. Our kids, our sons, daughters, sisters, brothers, whoever in our families that are under a waiver, it's a Medicaid or medical assistance waiver that's approved by CMS. And there's a cost sharing. The state and the federal share about half of what that waiver money goes. It is. And it goes to services for residential and also for day services and a few other things like that. So in 2007, CMS said you're out of compliance. They told every state that. Every state had the same situation of having an unacceptable way to handle the rate system, or how they calculate rates, or how they put rates together. And so in 2013, the Minnesota legislature passed, by lead from DHS, a statute with several little details in it. That's the, as we know, a disability waiver rate system setting. It wasn't until maybe, as Steve said, 2014, 2015, it started to become more clear about what was going on there. Built into the statute are several parameters that go into what is known as RMS, Rate Management System. That's the algorithm, the big calculator that indicates what the rates are by individual. It used to be rates were done, there was 87 counties in Minnesota, 11 tribes. They all been negotiated with their service providers in their areas for their contract rates by day, for day services as also as residential services. It was a totally distributed model. Everybody's out there doing their own thing with some oversight. It wasn't, I think it was not unfair per se, but it's just a different way of doing it. CMS said they wanted a standardized methodology to be used, not to have a distributed system like this without the parameters and without the checks and balances. And so that's where RMS came from. And unfortunately, I think, all the parameters about the regional factors and the transportation, all that stuff was built into the statute. There's several lines in the statute that say what those parameters are that are part of this big algorithm or the big calculator about rates. Again, rates are moving from being by program to being by individual. So every individual has a different rate coming in the door, ProAct, according to what RMS is going to do. At the time of the statute in 2013, they put a 5-year banding period in, which means let the system get figured out, but for the time being, freeze it to a 0.5% to 1% change per year, no more than that. So we've been kind of insulated from the effect of RMS by the fact that banding period has been keeping us pretty level, 0.5% to 1%. And that's quite an interesting situation, but at some point, people are going to fall off the cliff when things go to what the algorithm says you're going to be at, and that's coming. It was going to be the end of 2018, but CMS has just recently approved a 1-year extension, making it effective the end of 2019, which is great news. Another reason why that's great news, it gives us 1 more year at the legislature during our full budget session to go after the rest of what we'd like to have for DWS fixes. That's really an important thing as well. So that's what's going on. Anyway, just keeping reading through there, I kind of covered this already, the rate banding and so forth. I guess number 4, I talked about the report, and it's the first resource on the resource sheet, the Getting Connected. It's the first link there. It's a very well done report. They've been very responsible, I think, in doing this report, more or less. It does indicate what's going on here, but in that data, in that report, it talks about what kind of rate changes are going to happen. And you can see that the day training and rehabilitation category will experience about a 9.3% across the state reduction, 9.3%. Now, to be fair, there's some other modifiers in there that might be not quite as bad as that at the point of this report. 63% of all persons with intellectual and developmental disabilities using day services will see a reduction. 37 may be seeing a lift. That doesn't correlate to data that Moore's taken. Moore is seeing a much more dramatic, more like 71 to 72% reduction, not 63. But still, we're talking about some very significant cuts. Any way you look at it, even their own data, DHS, is enough to say, this is really what hurts people. This is not going to be good. And that's why we've been working so hard on what we've been doing. Interestingly also, the metropolitan counties are being hit much harder than outstate counties. And so that's why the compound effect of being in the region of the metropolitan area and also having day service or center-based services, you're getting kind of a double whammy there. Goodhue County, I don't know what Goodhue, this is Goodhue County here? I'm not sure what that county is. I have the data, but I just didn't look at it before I came, but that might be something to look up. So issues. Number 5 is the issues. And I'll talk about, there's actually quite a few of these issues that we'll talk about in terms of what's actually in the omnibus bill that was fixing some of this stuff. But it talks about several of these parameters in the big calculator, the big algorithm that ended up being really tough, really hard on people that use center-based services. Facility rate factors. If you have a pole barn with a dirt floor, you're probably fine. I mean, that's kind of what they envision in terms of the rate management, is trying to decide how much of your rate should be going to facility. And a lot of facilities have a lot better features in them, and that's one of the issues already, right from the very beginning. Transportation, utilization assumptions. They characterize utilization as a 3.9% versus what I think is 96.1, but that's what they were assuming, that the attendance basically would be of a day service. That's totally unrealistic. There's no data that suggests that's an appropriate number. Residential programs might see that kind of attendance rate, because even if you're sick, you're probably going to be in your residence, right? But not at the day services. So that was one very, very poor setting in there that got into the statute and then had to be fixed by the legislatures. Nobody else beside the legislature can fix their own statutes. Budget neutrality. There was an agreement that even after the calculator had done its work, there'd be a budget neutrality factor for all the subcomponents. In the original language that was there. CMS says, no way, that does not conform to person-centered planning. And so that was rescinded along the way, that CMS would not accept that piece. We talked about the healthcare workforce openings, the regional variance factors. There's several parameters. It's fairly complex, but nonetheless, it's all built into the statutes, and that's what we had to go after and look at and change. That really was producing these, very difficult and challenging rates for people with disabilities that really depend on day services. The data in this report, and I don't have it on this page, but in fact, it's a presentation made by Alex Bartalik at the Disability Services Division within DHS. She made a presentation at one of our sessions we went to, I think it was January 23rd, with the Health and Human Services Committee. And the data said there's about 12,500 people with intellectual and developmental disabilities, maybe 13,000, that are getting waiver money to do that within the state of Minnesota. There's more people going to day programs. We're just talking about the ones that are under a waiver program going to day services. Of that 12,500, 13,000, there's about 2,700 that use supported employment services within that. So the balance, about 10,000, a little bit over 10,000, are really depending on center-based day services. And every program is trying to push people into supported employment, community-based employment. They really are. And so even with all that push, and ProAct is one of the absolute leaders in this area, getting people out of the community, absolutely one of the leaders. Even with all that push, you still have 10,000 versus 2,700 in supported employment of that population. So that kind of tells you, if you take away the center-based services, the base, I mean, they're not just going to all find their way. You're not going to find 12,000 in community-based employment. So just another factor in that data is actually provided by DSD. This is an interesting page. We've had a lot of discussions with Disability Services Division. And one very senior person said, you know, this is inflammatory, Jim, what you're putting out there. And I said, what's inflammatory? What's wrong with it? What specifically is an error in this piece of paper? There isn't any factual errors in it, they just don't like it. That's what the answer. So that was rather a compliment for me to think that. I was happy to hear that. So anyway, that's why we've kind of focused on DWRS. It's also something the state has a prerogative to do something about. When it comes to some other things, and WIOA might be one of them, WIOA, we don't have as much prerogative at the state level to do much about that as we do with disability waiver rate setting. HCBS is around the corner. It's 2022 now for that. That's probably another one we have some prerogative in the state to do the right thing in spite of what's being pushed from CMS. We won't talk about HCBS too much tonight, but that might be the next thing around the corner. And we're kind of focusing on things that the state can do something about rather than not, spending time, in Washington with whatever's going on with AHCA or whatever's going on. So that's kind of our focus. We're going to continue to stay focused on DWRS because, again, we feel like there's more work to be done. We've got to stay in the game here, and hopefully the 2018 and presumably, more importantly, the 2019 session is when we can really get some other work done to try and fix the remaining parts of DWRS that we did not get fixed in this session that we're in right now. Okay, with that, I'm going to ask Jerry Smith to talk about DWRS, and he's also got his own case study to kind of walk you through, and also how to look and what it looks like to get your numbers, to know your numbers for an individual that you're kind of looking after. Thank you.
Hi, everybody. We got a pretty good crowd here. I'm a parent and a guardian also. I have 2 handicapped kids. I call them handicapped yet. I haven't quite got myself into the intellectual, and I just they're disabled, and try to do everything I can for them. My son is 41 years old. He's severely autistic, so he's quite a handful. He is in a group home. And my daughter is 34, and she's got about 11 different disabilities. Tourette's and autism is one of the main ones also, actually. And she's in a group home, and she is on a waiver, AD waiver actually, for the group home and for the DTNH. She goes to TSE during the day for the job placement type thing. And with that, actually, I kind of found out about all this information about DWRS kind of by accident. My daughter was having surgery in early 2016, and I was talking to the group home owner about some of these changes that I did know about already at this point that were coming down the pike. And she asked me if I knew about DWRS, and I didn't know what she was talking about. And she said, mentioned to me that my daughter's rates that she receives for the group home, what the state pays, and also from what I understood, actually doing some digging. That's where I found out about the DTNH, the day placement, the day training, like ProAct is here, that was going to be changing. So the next couple months in early 2016, I spent a couple months talking to a lot of people, trying to find out what that rate change was. Most people I talked to didn't know what it was, especially at the county level. My daughters and my son both are part of Ramsey County services. So I talked to my social worker, and then I finally ended up talking to the manager of the social worker area, and she basically they told me, you can't have those figures. And I'm the guardian, I'm the parent. Why can't I find out what those figures are? So after a couple months of not getting very far with the county, I ended up going back to my group home, the owner, and she gave me a copy of the DWRS, the new rate system that would take it after the 5-year banding period, how much money as a group home she was going to receive for my daughter. And that's where I've got this PowerPoint here. My son is a little bit different situation. He's in the ICMFR facility. It's a funding stream they started back in the 70s and early 80s which is a little bit different, and that's not really being attacked at this point, like the waivers are. If you go to the second page there, the rate management report 6790, this is what the form looks like, actually. When we talk about that algorithm that has about 11 different categories that the state created to come up with these figures, this is basically after, you know, they got each one of the group homes around the state that was providing services, and they did the same thing for the DTNHs for day training. And they had to supply the state with all their information, each group home, with the information as far as how they handled their the direct care staff and the nursing and transportation, things like that, that each group home owner had to supply to the state. And from that, then, they took that algorithm that they have, and each individual, each client that was in each group home, then they would come up with the information as far as how much money that individual was going to, how it was going to change after the 5-year banding period was over. If you look at it, we've kind of blacked out the information as far as the provider. But some of the information in the middle there that has to do with, that's the information that the group home supplied to the state. And these categories are what they use then to determine how much money my daughter was going to receive, 5 years down the line. At the bottom of the report there, we have some circled items there. Right now, my daughter, the historic rate that it shows on there is $267.55. That's what the group home gets daily, well, at least 28 days. Some, it used to be the group homes actually received the full 31 or 30 days or February 28. Somehow they've come up with it that they only pay the group homes now 28 days of each month. Why they don't get paid for the other days they're providing services, I have no idea. The group home owners don't even know. But they basically are gonna, not getting everything it should be. But if you look at the rates, then you see the RMS rate. That's part of the rate management system. Her funding will be reduced, the daily amount of money, the per diem, as I call it, that goes to the group home is going to reduce from $267.55 a day to $163. That's a 39% drop in the funding that for one client. Now, I've talked to the owner of the group home where my daughter resides, and she has 11 other clients that are in 3 different group homes. And basically, she's seeing the same kind of reduction for all my daughter and the other 11. And the group home's going to lose about $400,000 in funding. The owner has already said, I'm going to have to close the doors. I mean, they have, I think, like $1.2 million budget annually, and they're going to lose about $400,000. There isn't any business I know, locally or around the state, that could handle that kind of a reduction. So that's one of the reasons we're up here. We need to have you guys make sure, as parents and guardians, find out, go to your social worker, and if social worker doesn't provide you with that information, then go to the group home provider itself. And how many here actually are parents that have kids that are actually living in group homes right now? Well, quite a few. Have any of you guys gotten those figures? Most of us don't know about it. We're finding out by accident, finding out by listening to groups like MNFAC. And it's important for you guys to find out how much of a change you're going to see for your child. And I really hate the idea of anybody else, any other group homes closing. In the large metro areas like Ramsey, up in St. Paul, Minneapolis, I expect to see a lot of places closing because of this.
Well, what will happen to the children?
Well, that's a good question. I've asked the state that, as part of our testimony. When the legislature actually had some committees going to, talk about these kind of changes, they didn't have an answer. In fact, they haven't, at this point, even started developing any kind of an emergency situation for when these changes go into effect. Now, and I'm worried about it, and that's why we're doing this. We started as a group, this is one of the main focuses of our group, was trying to let everybody to get as many people in the state, parents and guardians, to know what's gonna happen and to contact their legislators. It's not gonna get changed unless we all, talk to, our legislators. We just went through a budget year. There were some changes made, but not enough to protect us from a lot of these places closing. That's why it's really important. We're gonna keep hammering on this for the next few years. But it's gonna take a lot of people, a lot of parents and guardians to impress upon all the legislators around the whole state. They passed this law in 2013 and went into effect in January 2014 with that 5-year banding period. We do have an extra year coming now, but I'm worried myself. I mean, I would hate to think about having to go through the process of trying to find a place for my daughter in a couple years. It was so hard to find a good place to begin with. So that's, I'll go in next page actually. This is, she goes to TSC, and this is actually the report of the funding change, the RMS rate change. Currently at TSC, TSC is getting $82.27 a day. That's going to reduce by 21% to $64.90. And from what I understand with TSC, they have a lot of individuals, same circumstance. Some parents I've talked to are losing as much as 50% of the funding. I know we were at one month back actually in Oakdale, and they actually had all the DT&H program had all the information for each of the parents of what those rate management changes were going to be. So they actually had them available at the meeting. And one gal looked at hers and she saw it was going to be 50% drop, and for just, what am I going to do? So it's really important to find out what those figures are. Now, Steve, do you have those available to get to,
I think
on
we
each
can get
of the clients?
individual screenshots if
Okay.
people want them.
Yeah, basically, I think that's what you need to do. It's very hard at this point to getting the information from your social worker, because they have not been directed by the state what to even do at this point. So the easiest way to get that information is talk to the group home providers, and each one of them, they have that information. The same thing with Steve, Sally here. I think the easiest way to do it is contact them. They have that information and get a copy for you, so you can find out what those changes are. Now, in this case, as I said, 21% drop is quite a bit of money. I know some, Merrick, I believe, in town, they're a pretty big outfit. I think they have 375 clients. They're losing over $900,000. That's just one organization that provides services during the day, jobs. If they lose that kind of funding, there's no way they're going to be able to provide the services that they need to with those kind of drops in funding. The next page actually it shows the actual figures, how much like my daughter's losing actually with the SLS, with the group home. That drop from 267 down to 163 means one client, $35,000. That's a lot of money for an organization to lose. And if they have 11 other clients, like I talked about, that are similar, I don't know how they could, she's already told me that they will close. So I've been working with the state to try to find out what we can do with Alex Bartolik, who heads up DSD at Department of Human Services. So they're kind of using my daughter's group home as a test case, because basically when I talked to her about this earlier on, 6 months ago, she's pretty much stated that they haven't heard anything from group homes saying that this was going to happen. And so their thinking at that point is, well, it must not really be impacting people very much, but it really is. And most of it's because we didn't know that this is happening. And that's why it's important that you do find out what the figures are and go from there. Like I say, our website has information about how to talk to a legislator, and Nancy's going to cover some of that here at the tail end of the talk, actually. We have some letters, test letters that you could use out there to contact, your legislators. And if you do that, the best thing is to do it, handwrite that, and tell them what your story is about what your child, he likes where he's living, he likes his job, they like their job kind of thing. You gotta let them know that, and at the same time you tell them, well, they're gonna be losing this much funding. What am I gonna do then? So these are the kind of things that we're trying to impress upon everybody. Know their numbers, and if you need help, as far as you're not feeling very comfortable about talking to legislators, we've got information to help you in that area. Any questions at all?
This is all for the state legislation?
Basically, this is what happened is in 2007, Medicaid said, all the counties were doing their own contracts at that time. Medicaid says everybody has to be evaluated the same way. So it used to be, each county evaluated an individual based on their degree of difficulty, how difficult they were to, in a group home setting or in a work setting. And these waiver contracts were created with that in mind, as to how difficult and what kind of staffing a person was going to need. Medicaid said you can't do that. You have to evaluate everybody the same way, and that's why they came up with that algorithm. I think all of us would say it's not very fair because everybody's different, and depending where you live in the state, some counties, there are counties where the contracts were too low. So there are some people around the state that are actually getting increases, and that was kind of the hope that it would maybe make it fairer. But what's happening is when the legislature passed this law, they didn't realize what kind of an impact it was going to have, how badly it was going to be for the major, the large counties and metro areas around the state. Because it costs a lot more to actually, if you're living, as far as your homes, transportation, things like that, a lot more expensive, I think, in your metro areas than they are in the smaller towns. So it's making it a little bit fairer for the smaller towns where the contracts are going to go up, but they're drastically changing what we have, and I'm sure Red Wings, I don't know what kind of figures Steve has seen as far as reductions, but you all need to know what those figures are.
The screenshot that you have is very similar to the ones I've seen for some
What's
other
that?
individuals. The screenshot you have here
Yep.
is very similar to the ones that I've seen for some other individuals.
Yeah.
But we don't get the screenshot for everybody. They're supposed to supply
don't?
it to us, and they don't all do
Okay.
that.
If you don't have them, one thing I did, I've been pushing that as part of our MNFAC group. I've really been pushing Department of Human Services. In the law that was passed in 2013, the law said that each county is required to let each disabled individual know, and each service center, the DT&H programs, and the group homes. The information was sent to the group homes and was sent to the job sites, for the organizations that were providing work. But the state has not, David, when we were up there talking to, testifying on the committees that they were having, that started over January 23rd on, one of the questions I put to the legislators is, the Department of Human Services has yet, and this went into effect January 2014, has yet to determine how to give this information to the disabled individuals. So we're 3 years into this, and they haven't done anything yet. 3.5 years, actually. They have finally, I got an email about 2 months ago, based on the pressure that we've been able to put on them. They have finally come up with a program where all that information is going to be given to the social workers, and going forward from that, whenever you have your annual reviews for your kids, that's when the social worker is going to be required to pass that information on with you. So if you don't get it, and the caveat with that information, they aren't going to have this program up and complete until the end of 2017. So So you really, I mean, the social workers probably are not going to have that information available to go over with in the annuals until 2018. And at that point, you know, we've lost a lot of time, so not a lot of time to really plan for, you know, what's going to happen. But you know, definitely if you don't get it, ask them. If you have annual reviews coming up, bring it up. You know, if your social worker doesn't have the information, you as parents and guardians, you want to require that you get that information as soon as possible. Because they are, by law, supposed to dispense that information, especially at the review.
Thank you, Jerry. Jerry did a great job of talking about the subject. I just have a few comments to make. I even go a step further, and I've told our social worker for my son, don't even come to the meeting without this information. I know I can get it from the service providers, and I have, but I think it really should come from the case manager, what's really the story. Because that person is responsible to help us plan as well. I don't know about your son or daughter or sister, brother, or whatever, but my son is not very good with change. It's going to take a couple of years to try and get him to a point where maybe he's not going to be as vulnerable to a center-based setting as he is right now. That's where he's dependent on that center-based setting. It takes that much time, and we're running out of time. And I have, like Jerry, we have been pests, hopefully in a healthy way, but we have been pests with Disability Service Division. We are on a first-name basis with many of them, including Alex Bertali and Claire Wilson and many others. And I've asked many times, why are you not communicating this information? They said, well, technically nobody's been hurt yet. We're in the banning period. And that is such a bad answer.
It really is.
It's a bad answer. There's got to be some other reasons, but that has been the answer that I got. Nobody's being hurt yet because we're in the banning period. Okay. Let's move on. The next two pages are a grid that ARC had a really nice seminar or meetings. Maybe you had one down there, I don't know. But it was really captured what Steve was talking about the very first meeting about several other things in motion. And I thought I'd just share with you, it's a one-page or two-page grid. I kind of like to talk about it a little bit just so you know some other things going on besides DWRS, and they kind of fit together to some degree. I like to start with the second page. Let's just talk about DWRS. It's the middle row of this little group. We kind of talked about it already, about the requirement for a uniform methodology for determining rates, how providers are consequently going to see reductions or increases. We're certainly seeing a lot more in the reductions than we are increases. The very last square there talks about implementation, and this grid is not current, but that used to be 2019, it's now 2020 for the first of 2020, which gives us another year. But I thought it was a pretty good grid to kind of analyze the rest of the things that are going on that are certainly very compelling. Right below that is something that's near and dear to ProAct's part, is what's going on with WIOA and what the new roles now that vocational rehab services has with people with intellectual and developmental disabilities. And it's trying to set more limits and make it more difficult, especially people coming up through transition, to use the special minimum wage of the 14C certificate and try and get them more into community-based settings, which is a great goal. I mean, we all have that ultimate goal, is to have our children in community-based settings. There's no question about that, whether it's residential. I'd love to have my son in a community-based job, being paid competitive wages. He can take a city bus to work, but you know what? It's not in the cards. You know, at least in the short term. We'd like to see this long-term goal perhaps, but for, like I said before, a bulk of the people that have this disability, it's just not going to be there. But there's more pressure, and this is what's going on. ProAct did just a wonderful job with the way to work. Maybe you've heard about that, but just did a great job of getting even more of a demonstration project going to have people who are pretty much center-based bound and not really interested in community-based to get kind of push on the envelope and get them out in the community. And the data was pretty good, pretty compelling. They got about a 10% increase in terms of people that went out from the base of 213 people or so that we had in that project. It was a great thing to do, and that's fine to be pushing the envelope, no question about that. But again, 10% more of the base is okay, but it's certainly not 60 or 70 or 80%. That's just not what's going to happen. Anyway, that's a pretty good sheet. And also the HCBS, Home and Community-Based Services, the very top row. That's another thing the state has the prerogative over. They're doing a lot of getting a state transition plan to be approved by CMS. And it follows much the same logic as DWRS because they're related. They're really much the same thing. But the very last square in implementation is very interesting to me. Just recently, CMS has announced that their deadline is not March of 2019. It's now March of 2022. They're given 3 more years for these transition plans in each state to be approved by CMS to move on with, again, the same effect, the same push in getting people more community-based. HCBS, Home and Community-Based Services, final rule should kind of indicate what the bias is. Okay, community-based everything, and that's what the direction is going. Back to the first page then of that grid, just another couple indicators. Department of Justice has been actually working pretty hard in a couple of states. I've not noticed this in Minnesota, perhaps it's coming, but they certainly have had a couple of things in a couple of states that they don't feel the state is working hard enough in terms of moving people who are publicly funded, meaning getting labor money, into employment services that are more community-based and competitively paid. And that's certainly a the very last square I thought was very interesting, it's very true. Minnesota has had a long history of having good services for people with disabilities, but it's also regarded as much too high dependence on center-based employment. And that's what's under a great pressure, great focus at this point in time. The very top one is the Homestead Plan. That's a very complicated plan. Donovan Frank is the judge who gave us the Jensen settlement on that some years back. The premise of the Homestead Plan is to provide choice and opportunities more so than they have today, but we kind of see that as the opposite. What's going on with HCBS, what's going on with DWRS are actually trying to take away choices, not add choices. So I'm very concerned about where that's going, but maybe potentially down the road, the Homestead Act, or the Homestead finding, the Homestead judgment in Minnesota, will be something that will actually protect us for what's going on here. Maybe we'll see. We'll
But
find
the
out.
problem there, it's not really funded.
Yeah, it's not funded. It's an unfunded mandate. Okay, let's see, where are we? Let's talk about the legislature. That's kind of the next thing. And I've got the summary here, but before I start talking about the omnibus bill, we had a couple of senators, particularly state senators, Jim Abler being one of them, Paul Utke from Park Rapids, John Hoffman, and Jeff Hayden was also another person apparently was in there, but those 3 started a working group. Jim Abler is the chairman of the Health and Human Services Committee in the Senate. The Senate and the House both have HHS committees. And the Senate one started the lead on what was to go after and look at the sustainability issues around day services. That was really their main thing with DTH or day services, their main concern. And they had a working group that met 4 times, starting January 24th. And it was a wonderful opportunity for many of us to come testify about our kids, our situations, the ones who knew our rates. Many were service providers, many were people who were being paid to be there. And the parents, Nancy and Jerry and I both testified at least a dozen times before the Senate and also the House Health and Human Services Committees when we had the opportunity. We were able to tell them we're probably the only people in this room not being paid to be here. And we are ones who don't have a special interest other than our own flesh and blood. Everybody else in here seems to be, being paid to be here or something. And that did have a lot of bearing on people in terms of we're the parents, You know, service providers are always considered to have a special interest because they have a P&L and a bottom line and they're all making too much money and all that. It wasn't the case for us. We're not making money. We're looking after our own children. So there was a tendency, even though we didn't know 10% of what a service provider would know, we knew enough to say that here's what are the facts about our kids or what's going on, and here's what the facts about what was coming down with DWRS, and it's just not right. It's got to be, something's got to be done. I was rather encouraged by the audience we had. It was good to see. I was discouraged a little bit by the fact that we were typically the only parents in the room when we went to these meetings. We went to many meetings. Every time we could go, we had at least a couple of us there. So that's why I'm kind of talking and asking people to pay attention to this stuff, to look at it, because especially with 2018 and presumably for sure 2019 rolling around, we want to have dozens of parents, not 2 or 3 at these hearings, to listen to the stories and have legislators get more interested and concerned about what they passed in 2013 that still is a mess. It's not right. So anyway, we started with that. We went all the way through until finally, you know, you have all these bills. Each of the two, the House actually picked up the same bill as the Senate and wrote it a little bit differently, but pretty much the same bill. But the Senate started to work. The House HHS Committee, leadership Matt Dean in that case, who was my representative from 38B, by the way, which I had a chance to meet him and talk to him several times, actually. So we were able to go and testify. Sometimes those HHS meetings were being held at the same time. So we had, you know, somebody over there and somebody here. Best Life Alliance also had some very articulate, well-prepared parents, and they had a very compelling story with respect to the healthcare workforce crisis and needing the 4%. That was their campaign of 4+4 and so forth. And those are very, very good. I learned an awful lot by just even being there and listening to other stories, and could see how we're competing with a bunch of other people in terms of these dollars. It's real competition. There's some very compelling stories about mental health and everything else going on too. So, but it was terribly interesting, if nothing else. Even just go there and listen is very interesting to know where this kind of fits. But anyway, we did have opportunity to testify. Finally then, an omnibus bill was developed, which is, like it means, is bringing all the laundry list items into one thing. The House did the same thing, and then they had a conference committee of select few of each of the two to develop what is known as the HHS omnibus bill, that then was approved by both the House and Senate. And they had different bills they both approved, but then the conference committee had to go reconcile the differences and come up with one bill, not a Senate and a House bill to send to Governor Dayton. So then the process was then the conference committee gelled it down to one bill. And then that was finally approved by Governor Dayton, which was actually a surprise, because he started off with wanting something totally different for Health and Human Services. The Senate wanted something different. The House had a much more big objective to save more money. But finally then, everything worked out, and several items, like, as I mentioned already, survived the test, survived the DWRS cut, if you want to call it that. Unfortunately, the Best Life Alliance one did not make it. The 4% campaign was $109 million right out of the chute. There's no way they could look at that and say they could put that in. At this point in time, both the Senate and the House HHS committees wanted to cut money and not add to it, and that was one of the consequences there, which is unfortunate, but that's what happened. So, as you probably are aware, Dayton signed those bills, but then he took the line item veto and canceled out the money going to fund the legislature, so I think we're going to go to court, have our taxpayer money, pay for some more lawyer time to settle that. But, so it's not absolutely slam dunk at this point, but we were pleased that at least some elements of the DWRS bill or in the omnibus bill was approved. And so
I just mentioned too that, I mean, that 4% that we were talking about, the state is the one that sets the wage for all of the direct care staff. I mean, they set that wage, and it's, what is it, $12 and $12.31 an hour or something like that. And we keep, you know, we have such a shortage of direct care staff workers, both at group homes and in, you know, the day training centers. We need to have that raised. They need to be paid more money so we can compete with other jobs to get staff in. We talked about, we've got just under 9,000 job shortage in the state, and the only way it's gonna change is if we can get the wages raised for the direct care staff. And that's what really the Best Life Alliance has been working on, trying to get a fair wage for these staff workers.
Which is part of the algorithm, by the way.
Yep.
Well, that's what was confusing to me is, you know, at the same time that the base wages are in the algorithm, and there are some parameters in terms of inflationary increases, and we'll talk about that in a second. But then the campaign, Best Life Alliance, the previous campaigns, and the one that was successful, I believe, in 2014, kind of superseded that one. So it's interesting, they went ahead and moved them ahead, but DHS somehow had to weave that back into the DWS structure, which they did. That's how the rates got improved in 2014. So anyway, what this letter is a letter actually the lobbyists for Moore wrote this to their organization. We were allowed to use it to talk about what is in the omnibus bill in terms of improvements in DWS. And I just kind of will walk through a few of them, kind of getting down to the bottom. The governor wanted, he felt there was a double whammy or a double effect of 7%, and then the CPI, the other inflationary factors are in there, and he wanted to eliminate that potential redundancy or double whammy or double hit. And he was very unnerved, but the omnibus bill did not include that, so that will help kind of get the wages up and get those costs up, even in spite of the fact that the Best Life Alliance wanted that didn't ahead. One thing that we were really pushing hard for, Moore was really pushing for, is getting the inflationary factors with CPI and BLS, Bureau of Labor Statistics, and CPI is the Consumer Price Index, to be used every 2 years to make the wages go up, and if they didn't get that, they got it every 5. And then actually one is due this year, having started in 2014 or 2013 or whatever the base was. It should have been effective this year, which they will, but then it's only every 5 years that inflationary improvement comes about. But you know, it's in there. There's a 7th year of banding it's actually approved in the bill. CMS has to approve that. Whether they will or not, my gut says no, but then they put 3 years of additional years on the HCBS implementation, so who knows? Maybe this banding thing is okay with CMS. We'll see what's happening. That's an interesting one. The budget neutrality, of course, was thrown out. CMS would never approve that. They're going to do some granting to providers that have some innovative models. ProAct, I think, would be, they're very creative and good in terms of doing what they've been doing, and that might be a possibility for them as well, but that might help insulate the blow. If some programs are out there that can be best practices for others to follow in terms of moving to the next environment that have more community-based jobs at competitive wages without the need for the center-based. The utilization factor was increased to 9.4% from the 3.9, which was really a big win. There was a big fatal flaw in the previous bill. It's a big change. There are 3 new employment services, which is great. They're developmental, exploratory, and support. And support is really what we kind of know of as supported employment services today. But they've also said that DTH programs cannot have an employment program. Those employment programs have to be separate licenses. I think that's the way it's going to be done. We're going to study the absence of utilization factors for possible future modifications. Transportation data is going to be collected again as a way to try and maybe change the algorithm down the road. Again, those are good intentions, and we know what good intentions sometimes lead to. We'll see what happens with that, but that's important. I'd love to have our new advisory council of parents be able to grasp that and be able to do something with that and help form that, if that's really going to be an open possibility, but who knows, we're going to see. Provider cost review, they're going to take apparently some more effort to look at the cost structures of service providers like ProAct as a way to maybe help look at that a bit closer. That was actually the premise of DWS to begin with, and we're not quite sure why we're having this language up again, but that's what's there. As well as then a slight technical change in terms of regional variance factors. So there's several elements, excuse me, several elements that are being modified, and hopefully will moderate the rates. And it's going to take a while for ProAct and PRI and MSS to try to realize what these changes might do. It might take a while for the snapshots to actually reflect what these new changes are going to be. So we have to give it some time, but there are going to be hopefully some nice changes down the road. The very last thing I put there is a little spreadsheet. This is the dollars that we were kind of talking to, and we got all kinds of opportunity to look at these dollars a little bit. I thought it made sense to look at that. The DWS methodology, even with all those changes, is still going to forecast to be about $5 million less in spending. So they started with wanting to save $845 million with the house in the DWS area. It was $140 million within the, sorry, 140,000. Is that million or? I guess it was 140,000 at the Senate level. They finally came up with $5 million in savings, which is rather surprising, but that's what they have in there. So I'm not quite clear what that's going to mean, but there is supposed to be a negative, or it's supposed to be a cost savings to the DWS changes that are going in. We'll see how that develops, but that's actually a spreadsheet out of the most current omnibus bill that's out there. It's amazing what you can get if you want to take the time to look at it, and that spreadsheet is available. Any questions on that? It gives you some more detail on DWS. One other thing I wanted, there's two more things in here to talk about, then we'll get to the last thing that Nancy will do. This is a testimony that was given in one of those meetings that we were going to. I thought it was one of the best stories that a service provider could give. Now again, remember, they're considered to be special interests in their motivation to be there. But PRI did a great job and published this, and again, gave us permission to use this testimony, given I think this was in February. But I thought it'd be interesting to see it. At that point, they were projecting an aggregated number of about 19% reduction in terms of their revenue based on DWS when it finally hits and goes live. It takes them back to the time of 1999 in terms of what their revenue was at that point in time. They talk about their regional variance factor, they talk about transportation, the details are in there, but I thought it was such a well done, very well articulated story, and this is so similar. Even in some of the counties that we've been in Alexandria, we've been in Floodwood, we've been in Crookston, even with those counties that are supposedly getting lifts or very high reductions, they're still seeing 15%. This is a 20 or 19% reduction, something like that. That's very similar to what Merrick was. But this is what every one of these service providers we've been talking to, even out of state, are talking about in terms of what the impact of DWS is going to be. So I thought it was a very good testimony. It gives you a clue in terms of what they did to testify. I also threw in my own story, and I use this many times in ways. This happened to be a sit-down with Matt Dean, again, the chair of the House Health and Human Services Committee, and I just leave it for you to look at. I try and talk about his situation and him personally, and then talk about why DWS is going to be, harmful to his situation. And you can use it as you want, but this is the kind of thing that really makes a difference when we go talk to people, to legislators. We were at March 14th was a rally day. Moore had a day, Moore and Arm both sponsored a day that we were there as well. It was outstanding. We had filled the rotunda, and we had several speakers there. It was outstanding, and that what was really nice about that day, it wasn't just a speech in the rotunda and several politicians getting up. They were committed to meeting with everybody they could that day that showed up for that from a disability standpoint. And so they really made time to listen to anybody they could individually in their offices, and they did. They did listen to that. So, but again, maybe we'll talk about this a bit more in terms of advocacy, but just wanted to share that with you in terms of what I thought was fairly useful in terms of our testimony. Nancy did the same thing. Jerry, you've heard him already. He's very compelling of what his story was. But these really got attention, and I think we're part of why DWRS was undermined. We've got some changes, but many more are needed before this thing finally goes live at the end of 2019. Okay, Nancy, you want to talk about the advocacy?
So the last page is Advocacy 101. And Jim's letter is a great introduction. I'm going to give you a little bit of information first, and then I want to talk about Jim's letter and what's so great about it and what you need to copy. We're experts with our kids, and you know them better than anybody else. So again, and remember that the legislators work for you. So I think those are two kind of empowering pieces that you can feel inside as you're considering talking to your legislators. I just want to call out that it's very common to feel afraid, apprehensive, overwhelmed. Don't feel you need to know everything there is about DWRS. Obviously, tonight you've heard it's a very complicated system, and RMS is a very complicated algorithm. Don't feel you need to know all of those attributes and how all that works, because you are the expert with your child, and that's really what you need to concentrate on and not get overwhelmed. We do have examples on our Facebook page and in our website to see examples of what letters look like and what some things you might want to include in your letters. And I say letters, but I mean emails, letters, phone calls. You can leave messages. You can call at night and leave a message if you're apprehensive about talking to somebody on the phone. Just leave a message for your legislator, and I'll tell you what to include in that. But make sure that your tone is more of an educational standpoint, and don't do it in a fit of anger, or because that is going to turn your legislator off, and they may not listen to you. So really what we are here to do is to educate the legislators on how this is going to impact us, so that they can make wise decisions for us, because we pay their bills, right? We pay taxes. They work for us. So we need to tell them what it is we need. And that's what we're here to do. When you do make contact with your legislator, I strongly encourage you to make sure that you send a thank you note. Because they do, again, they work for us, but we need to thank them for the time that they took to listen to our letter, or listen to our phone calls, read our letters, and take action. And now I want to turn back to Jim's letter and talk about the different components that he has in his letter. The first thing is meeting Bob. And so that's an excellent way for you to start your communication, whether it's on the phone or whether it's a short email, is just to say who you are, who you're working for with your son or your daughter, your brother, your sister, your loved one. And then talk about a little bit about what the problem is, what you're why you're there, why you're sending them a letter. And what I encourage you to do is send your letter regarding DWRS or the Best Life Alliance, whatever your passion is. But really, again, we're trying to get one voice to the legislators talking about DWRS. And then a little bit about how you see a solution, or where you see the flaws. Always end your letter with your name, your address, your email address. They need to know who's in their district, and so it's really important to make sure that you have your email address so that they can return calls to you, or if they have questions, they can get back to you. So leave a phone number or your email. But make sure that your street address and zip code are on there.
How can you find out the addresses for your legislators?
That is on our resource sheet. Let me go back to that. In here, on page 2, there is a link. Contact your legislator. The second one.
Oh,
Yeah, it looks like this. And there's an email link that all you have to do is put in your address and it'll pop up, it'll come back with who your legislators are, what their phone numbers are.
I'm not into email. I was just wondering if there's a department I can contact for their addresses. Or I like to write letters more.
And letters are good, they like letters.
Oh, okay.
Okay. That was about it for advocacy. Are there any other questions? Yes?
So, in this page about the to more members dated May 30th, it says the governor called out the 7% offset. Did he want to give it more money or less? I can't
Less.
figure it out.
He thought that there was a double adjustment going on there, so he wanted to cancel, take the 12 to 7 away from the inflationary bump.
Just,
He thought it was a compounding, and there's debate on either side of that, but fortunately I said, no, leave the whatever that what, and I can't speak to it more technically than that.
okay. Well, it's confusing.
I have to tell
Not
you-
as confusing as when he talks.
Yeah.
Yeah.
Yeah, well, I can tell you, I mean, from what I gather, Governor Dayton is not our friend. He thinks that people with disabilities are getting enough money already, redistribute what you have. That's been the basic message we've been hearing. And the reason is, and Steve and I are both on the advisory committee for DWRS, and I've talked to them many times offline. So fundamentally, Jim, they've told me, you have to understand who we work for. We report to the governor. So the governor has already said, this is what you're going to do and going to get, and you've got to redistribute within. He wanted to take money away from other programs to pay for the new employment programs. So that's fundamentally what's going on. They report to the governor. And he sees other priorities besides people with disabilities. K through 12, pre-K, I mean, you name it, but this is just not one of them. So, in fact, I got my letter, finally got a response from Governor Dayton today to my many emails and letters to him. And basically, it was a form letter, said, thank you, it's really wonderful that you are paying attention, and look at our website. They didn't address any of my questions whatsoever, or my comments. I could have been talking about the Green Line or whatever else, it didn't matter. Look at our website, that's the most recent stuff, and I was really disappointed. But that's my opinion of what I see in talking to many others, what's going on. The governor is not our friend.
I got a question. It seems like the whole thing started at a federal level with them requiring the state to do something different. Is anything being done federally to say, why don't you just leave alone what's, I mean, because it seems like they are, at least our state was working it out.
Actually,
But they
from a
thought
federal
fairly-
level, they're looking at making it worse.
Yeah,
With the current
why?
administration,
What's the,
they're looking at reducing the funding even more.
Well,
which-
Medicaid, they really want
Right.
to cut
Yes.
that.
That's what we're worried about at this point. So we, at this point, coming out of, DC, we don't know how bad it's gonna be yet at this point. There are a lot of proposals out there to do more funding cuts. And as to how it would affect Minnesota, we don't know at this point, but
the
it
thing was
doesn't
when
look
it's
good.
federal too, they end up putting regulations on which requires people to do more work rather than save funds. Like, there's more paperwork to do for federal.
Yeah,
Yeah.
they've
And then-
increased paperwork dramatically.
Twice in the last 6 months,
Yeah,
I've
I-
gone to extra meetings to sign extra paperwork that's federally mandated.
Well, it would cost the
And-
providers more money to have more staff and more
Right.
bureaucracy to go through. But, I had an opportunity to meet with CMS directly, face-to-face in Chicago. There's regional CMS people we met with. And that was really interesting. And I think that they're being told they've got to reform Medicare. And so they put out these broad parameters. The methodology is screwed up in Minnesota as well as other states in terms of rate management. But they're not saying cut the rates. Minnesota is the one who put together the algorithm and decided on their own. That's why I think there's a political motivation to go after center-based employment and get rid of it. Because there are a lot of people out there thinking those are many institutions.
I think we should take all of our children to the legislature.
Yeah.
Well, that was
That
March
was
14th.
March 14th.
March
they
14th.
got it.
That
I
might be
have my
happy with these
son-
funding
And they
cuts.
should stay with the legislature.
Well,
Yes,
That's why I'm glad, that's a great lead, because please watch our website,
Yeah.
because we'll be talking about, and it won't be for a while, because it won't be till the next session, but when we have that opportunity again to go bark at them, 2018 and 2019, we want you there with us on March 14th, or whatever date it is. We'd like to have more of you there, if nothing else, just being there. If you're not gonna speak, that's fine, please hearings. They're critical, because the legislature is the only place that can be changed. DHS is not gonna do it. The current governor is not going to do it. The statutes have to be changed. It has to be the legislature that does that. Fortunately, like I said, we've got some legislators that really want to try and change it. I have to give one little story. Roger Chamberlain is my senator. He's a tax guy. He's not that, big in terms of disability. So I went and sat with him, finally got a meeting with him. This is going back in like September, October of last year, well before the session started. And I said, do you know what happened in 2013? Do you know about DWRS? No, tell me more. So I had that one pager, and I gave it to him. He took 3.5 pages of notes. He was really interested, because he didn't know they didn't know what they passed. It was an omnibus bill. There's so much stuff in there, they don't know. And so once he learned more about that, he became really an advocate for what we're trying to do, and I was really pleased with that. And he even co-authored another bill. He's not in that committee, but he co-authored a bill on health and human services in this area, same area down the road. So, it's amazing. You don't think you make a difference. You do make a difference. If you take the time and you find your legislator, get an opportunity to put your story together, you're going to be surprised what impact that has, because not many people are doing that. So next time it comes around, I hope we see a lot of your faces in these hearings. It'd be a lot of fun to see you in there and have a good time.
Yeah, we've been talking quite a bit about talking to legislators, but we have an opportunity here also. And I guess we need to probably change our focus a little bit too, as far as what we talk about who you talk to. We have a new governor's race that's coming up here. We need to let each one of the individuals that are running for governor know what's going to happen as far as with DWRS and some of these other programs. They need to know. So, I mean, Governor Dayton is not doing anything about it, but he's going to be out next year. We need to make sure that whoever gets in as the new governor, that he's aware of this problem and he can look at it, or have his staff look at it. I think it's very important that we do focus on who's running for governor and making sure that they're aware of this.
Absolutely. That's a really good point, Jerry.
So when you go to your county fairs and the state fair and you see those people running, then you need to bend their ear and talk to them.
Bring your
about it.
slips with you. If you have somebody, if you got
Bring your letter.
Your kids are losing 40%, or as far as the training thing, if they're losing 20-25%, have those things with you. And if they see it, you can, if they want copies of it, you can email it to them, or you can make a copy and mail it to them. But this is the kind, they need to see this, not just talk about it, but we need to actually show them, this is what's happening. This is the rate getting now, and this is what it's gonna be. What are you gonna do to stop all these closings, or all these reductions in services? It's gonna be very important, I think, for whoever's gonna be the next governor. And the other thing I guess I want to impress too is, you came here tonight, and you're getting this information. You're going to get the figures for your child as far as what, how it's changing for group homes or for their training, the work centers. If you have other parents, that you talk to, that you're friends with and everything, that go, have kids that go to ProAct here, talk to them and make sure they're doing the same thing. Try to get this thing to, the ripple effect, you're gonna find out, help other parents find out also, so we can do something about it.
You guys might know, several months ago I got a satisfaction survey, and it was from DHS, my daughter. And I think it might have been this HCBS thing, but I don't know. I think it was about community integration and choices. That was the premise of it. It was interesting though, it was sent from California. So they couldn't even use a local state of Minnesota place to send it. But do you guys know what that was?
No,
Okay.
no, I don't.
It could be they just picking out a certain number for their survey and across the
But
state.
there's about 4 or 5 initiatives going on, so it's hard to
Oh,
figure
yeah.
out
Yeah.
what's what.
Exactly.
If it was women or
It's just
women.
amazing how many things are going, it's just, incredible. But that's why we could be involved in several things at once, and I think we would really lose momentum and be, we want to really be focused on DWRS for the time being. It has enough connections to other things, that's fine, but, that's why we stayed away, we want to stay close to things that the state has prerogative to make it right, which is DWRS and HCPS presumably, so we really focused and kept ourselves focused. We have people who are really asking us to get much more involved with the American Health Care Act, okay, and that kind of thing, and we've said, no, we're going to stay focused on this for the reasons I just said already, but, so, excellent questions and comments. Hopefully you've got some more ammunition and you can find a way to get connected, and there's many different ways to do that, and hopefully you can look at our website or be part of our meetings. The 18th of July is our next meeting, and hopefully we'll have a legislator or two that helped us really, that really did the right thing for DWRS, but it's really been a very good audience.
Yeah, thank you.
Thank you.